to the show. My first guest, Liz, contacted me because she says that her relationship with partner Malcolm is on the verge of splitting up, despite the fact that she is 3 months pregnant with his child. Liz says that they constantly argue and admits she doesn't trust Malcolm to look after her own daughter, let alone their unborn child. Take a look at this.
Come on, stop it, come on. My name's Liz, my little girl is Ellie, and my partner is Malcolm. The relationship is falling apart. Feeling a bit tired, that's all. In the past, I have used alcohol and drugs. Obviously, I'm clean now and have been clean for quite a few months, but this is one reason why it's messed Ellie's life up. When she can't have her own way, she will get very stroppy and will have arguments. Take your bag off and sit up. Come on. No! She will get very upset, and that's when I give in and do everything for her. Come on, it's that one, isn't it? Wait for it. Because Malcolm isn't Ellie's dad, I don't like him to tell Ellie off. I feel like I should be the one that tells Ellie off. Don't you dare do that, you know that's naughty. I am 2 months pregnant, and since the pregnancy, it's like I don't want to be around him anymore. I don't hardly say I love you anymore. I struggle to say those words now. Me and my daughter are currently living at my mum's, and this is another reason why me and Malcolm are spending more time apart. This will be the first time that I'm being 100% open and honest with Malcolm about our relationship and how I feel.
Hi, Liz.
Hiya.
Welcome to the show.
Hi.
So how long have you been clean for?
Since last September.
Last September. Congratulations. And what was your use? What were you using?
I was drinking alcohol, I was doing speed, cocaine.
Okay. All right. So was that daily?
Oh, it could be like 2, 3, 4 days a week, have 5 or 6 days clean, and then...
And looking after your kid at the same time?
Yes.
Okay. What impact did that have on your little one?
It's messed her life up. I haven't taught her respect. I haven't taught her to say please and thank you. She could click her fingers and I'd do everything for her. And because I was doing, feeling bad and guilty, I'd buy her affection.
Right. So where was you getting all the money for all this?
I was selling things.
Okay. So you were supporting, obviously, your use.
Yes.
And when was the point for you that you went enough?
Last year. My mum knew because I had to talk to her.
Was she involved in looking after your little one while you were using at the time?
Well, she didn't know at the time. My mum had an idea what I was doing, and I came clean, and she says, if you want to come clean, then she was going to take Ellie.
So what was the process? What did you do?
I went for help. I went for it was like a 6-week course. I think I still need more counselling, not for drugs, for myself.
What are you dealing with now that you feel that you need counselling for?
My confidence and jealousy, insecurities. I've never liked who I am as a person. I've always tried to be something else. I've never had the confidence, so with alcohol and drugs, it was giving me the confidence.
The false
Yes.
illusion that you were, accepted, fitted in to a crowd who were obviously...
The wrong crowd.
Yeah, doing the wrong things.
Yeah.
Let's go back to Ellie for a moment. What would she see?
Not a mum that should be giving her routines and taking her to school properly and doing her homework, which I'm doing now.
Yes.
But I wasn't back then.
Yeah.
And she'd miss days off of school because I felt too yuck or... She wasn't asked to be born and everything, and I just...
So, truthfully, you were neglecting her. I mean, you're on the drugs, drink, and neglecting her.
Yeah.
She wasn't getting what she needed from you in any capacity.
No, she wasn't.
Were you doing it around her? Would she...
She wouldn't see. She wouldn't see, but obviously she knew Mummy was different.
Yeah. OK, let's go to tape.
Stop it!
Ellie. Hi, my name's Malcolm. I'm engaged to Elizabeth. Mine and Ellie's relationship is like a roller coaster.
No!
1 minute she could be really happy, other times she won't listen to me. She won't do as I ask.
Come on, Ellie. We're walking. Come on. Why don't you want to walk? Come on.
She goes running to her mum.
Come on, let's just quickly hurry up home. Come on.
She absolutely hates me disciplining her.
Come on.
Ellie has picked up her behaviour from her mum.
No, why are you doing that, Ellie? What are you doing?
I do feel that Liz does rely on her mum a little bit too much and not enough on me.
Is it right to give her a bath a bit later?
I feel undermined by Liz most of the time.
Malcolm, can Ellie just sit there, please?
As a man, I feel rejected. I go to kiss her, she turns her cheek, and I feel I'm not wanted, not loved, and I just want that relationship to get a lot better. I can't wait to be a dad again, and no matter what happens between me and Liz, she will never take that away from me. All I can do is keep trying and trying, but there's only so much I can try.
Welcome, Malcolm.
Thank you.
So, where are we at right now?
Practically, I do not live with Liz at all.
You're engaged, though?
We're engaged, yes.
Yeah. Right.
Our relationship is literally like a roller coaster. 90% of the time, I go round there, we disagree, but we do have some good days, but very, very minimal. Sometimes I feel that Liz doesn't respect me as a man and let me help her, i.e. respect, please, thank you, everything that needs to be taught to a child at a young age. Literally, when I try and discipline Ellie, Liz does not like it. Full stop. I get the evil looks, her jealousy as well is out of control sometimes.
So, you've got this banter going on in your relationship, which is not healthy.
Yeah.
Ellie's stuck in the middle of all of this.
Yeah.
So, you feel right now that in this relationship, you've moved forward to want to make a commitment to be engaged with one another. However, you're feeling locked out because you're not feeling like you're being able to actually be a parent and teach Ellie what she needs and be a father figure around her?
I'd love to be a father figure to Ellie, but I'd never take the father figure away from her real dad.
Okay. So what do you really think of Malcolm? I mean, you know, what do you really feel?
I love him, but I walk all over him as well. And he needs to be strong. He needs to be strong to me and for me.
Why do you walk all over him?
He doesn't stand up to me. I haven't been in a relationship like this before where I've walked all over a man.
Yeah, but why do you choose to do that?
Don't know. I think sometimes it's how he talks to me, his reactions on his face, certain faces that he pulls. It'll get my back up straight away. I want us to be happy and back in love and none of this conflict between us. I want to be able to trust him with Ellie and to take her places.
How can you do that if you don't allow him to do that? And what does that feel like for you?
Unwanted. I've had enough now. It's me standing up to her now. I'm sick and tired of it. I'm not having her walk all over me at all.
So what are you fed up with?
The way you talk to me, the way you look at me. You sometimes always blow the smallest thing out of proportion. And it's the way you say things to me without Ellie hearing, which starts a disagreement, which gets my back up, and then you have a go at me making out it's all me in front of Ellie. And I do snap back, which I have got to stop.
Sometimes when I give you these looks or say something quiet, that's because I don't want Ellie to hear, but you automatically say something back to me so Ellie can hear, and then it'll really, really annoy me. And that's when I have to say something else. You know, why say it in front of Ellie? She's only 6.5 years old. I don't want her to be hearing things or whatever's going on. And I say that to you all the time.
Don't you feel that sort of makes it quite clear why she's misbehaving? Are you not surprised that she's behaving the way that she is? Because look at the environment you're creating for her. What are you saying that you need from Malcolm with respects to Ellie?
I want her to go to you and talk to you and everything.
Then let it happen. I'm trying to change now. I have tried my utmost best with her lately. I've been trying to do things with her. Just let it happen. Stop trying to fight against it. The way you act towards me, then Ellie rubs off on Ellie and she thinks she can talk to me like that and be like that towards me. I admit I have said things in front of Ellie which I shouldn't have. I have pushed her away sometimes. But now I'm trying to change that.
Poor Ellie. I mean, Ellie's stuck in the middle of it, you know, because the pair of you can't pull yourselves together and act mature and just act like adults and come to a decision. It's not fair on Ellie.
Can you get Ellie some pyjamas out of the bottom drawer, please?
My name's Catherine. I am mum to Liz, nanny to Ellie, and mum-in-law-to-be to Malcolm. Whenever Liz and Ellie have an argument, it just sounds like it's two little children arguing.
I'm taking it with me because I know what you like.
No, I won't change it.
Yes, you do.
I just want to take it out. No, stop it. Whatever.
Liz and Ellie have been living here for nearly 5 weeks now. I'm getting quite fed up of it. She took over. It was a tip. I'm having to sleep on the sofa in my flat. And I just want my own place back. Liz is trying to control him all the time.
You've only just had one.
I think Liz does love him, but she's not in love with him. But I do know that Malcolm still does love Liz. I think the new baby could make them or break them. She does not respect me.
What?
She doesn't respect herself. She doesn't respect my flat. In my eyes, until she respects herself, she won't respect anyone else.
Welcome.
Hello.
So what's going on with Liz?
What's going on?
No respect, no this, no that. I mean, what's happening?
She hasn't got any respect. She will not go back to her own place because she can't face it.
Is that true?
Yeah.
Why are you disrespecting her home?
Well, I was, but I keep on trying to.
No, I mean, why? Why is that okay? What do you mean I don't know? That's not acceptable. You know, your mum has turned around. I mean, you're a grown woman. Your mum has turned around and said, you can come and stay here with Ellie. And then you take the liberty in thinking that you can treat your mum the way you are. I mean, why? Why would you do that? Why would you disrespect your own mother who has shown you the grace to be able to come in and spend time? Why would you do that?
I don't respect myself then.
No sorry, no nothing?
I am sorry.
Then why don't you tell her? Then why don't you tell your mum?
Well, I am sorry.
It's not okay.
No, it isn't.
She knows how I like to have my place. And it had been like that for a couple of months almost.
I let everything go when I was doing drugs.
Yeah, but you're not now, you're clean.
No.
Which is a good thing.
The one thing that doesn't help is because of the way she brought Ellie up. Ellie thinks she can go around and do exactly what her mum done, like disrespect people's properties and everything else.
She just copies everything.
And so she copies everything Liz does. Liz is trying to change that, but where it's sunk into Ellie so much now, Ellie doesn't always listen either.
I don't tidy up after myself, I will admit that, but I go around tidying up after Ellie.
Yes, that is true.
But how are you setting an example then? How? What are you saying? You're going like this? I mean,
No, she's got to teach Ellie to tidy up herself.
if you're not clearing up after yourself, who's clearing up after you?
You are
I've stopped doing it.
sometimes.
I've stopped doing it.
Why does Liz not have that foundation put in place, Catherine?
I don't know.
Why?
She weren't brought up like that.
So tell me how she was brought up.
Clean and tidy. She used to tidy all her own toys away. I used to put clothes on her bed in little piles and she'd put them away. I don't understand why she's turned.
Trauma as a child?
Could have been. She's had quite a lot
Yeah?
to deal with in her childhood.
Seen a lot?
I have.
I've seen a lot.
Saw a lot in your own childhood? Yeah. Have you dealt with that? You spoke about that? Did you use the drugs to numb that?
I think so.
I think so too.
Yeah, because over years, she has been an alcoholic more than once. She used to hide it all over the house. And I even pulled up about it once when I saw them in the empty bottles and cans in the bin. And she said, they're not my friends being round.
Can we share that today? Can you share that with me so I can understand more?
Like I said, I think I've always wanted to be something I'm not. to either be a better person or to have confidence there.
What I'm getting here is that your upbringing, okay, has created a numbness. I mean, basically, the trauma from your childhood has led you to become somebody who became dependent on alcohol and drug use to numb from obviously what you do need to have counselling for now.
Yeah, and I think that's another reason why I sometimes am scared to talk to you. Like, I'll try and talk to you, but if I see a certain face or anger, I go for myself.
She's got that defence barrier straight away.
And then that is why I have to go to my mum to talk to Malcolm.
Okay, so your past is now playing a big part in your present life right now because it's restricting you from allowing Malcolm to have a close relationship with your daughter, right? That's basically what we're saying.
Yeah.
I'd like to go back to tape, please.
What Liz has put on me now is actually brought my stress levels up.
I always feel if I bury my head in the sand, it'll go away, or think about running away, just getting Ellie and just going. I hope the outcome of Joe's help will be that I do have a relationship again with Malcolm.
It does make me feel like I'm being rejected. And all I want to do is be that safety net that she can fall on and rely on.
I don't like to think where our relationship would be at this point. I don't even know if we'd have one.
To sort all these issues out means the world to me. I want our life back the way it was. I just want her to be that loving person that I know that she can be.
I need to change in a lot of ways, and I don't know how to.
Sorry. She just didn't realise what she's doing to me. I can't throw it out because my belief is when you have children, you're there for them.
Sorry.
It's good you're here today. It's good you're here today because it means that everything that you've been suppressing down, everything that you've been numbing, everything that you've been making out is not there, okay, that you've been running from, today you don't have to run anymore. You spoke your truth. I'm going to make sure that you get aftercare to deal with what's just come out of that lid. Okay, so that you can move on and understand why you behave the way you do, why you did what you did, okay, and the effects of you being a victim of that, because I think it's incredibly important for you to understand that.
Yeah.
Because until you understand that, you're never going to have a healthy relationship with Malcolm, never. Let's go back to Ellie for a moment because, you know, Ellie needs guidance from you. She needs the nurturing. She needs rules and boundaries. She needs the attention where she can emotionally connect with you. It's going to be ever most important for you as you're going through your therapy and understanding the victim you were, okay, and detaching yourself from really that little girl that you feel now in a big woman's body.
Yeah.
That's going to be important for you to be able to separate that.
I know.
Okay? But in the meantime, whilst that is happening, there's a little girl there that needs you to do her right. Do you know what to do? Do you know what she needs?
Yeah, she needs love.
She needs you to make decisions for her. decisions that are responsible. She needs you to be able to protect her and reassure her. She needs you to give her guidance and boundaries and rules and fun and good times. She needs you to educate her and to spend time with her. She needs you to make those decisions for her, responsible decisions that parents make. She needs you to be able to do that. I love her. Okay. So where do we go from here? Because we know what this little girl needs. She's just not having that consistently because she's stuck in the middle of the on-off relationship. You know, since you've asked for my help, you've been on and off, okay, because of this banter. And I believe that what needs to happen right now is, whilst you're going through therapy, okay, and you're at your mum's, full stop, period, understand what your mum needs, okay, from you to be there until that place is of living condition that you can go back. But you do need to go back.
Yeah.
You do need to go back. I'd like a time frame on that. What do you feel, Mum?
A month.
Got that?
Keep going backwards and forwards and doing bits.
A month. And I feel right now what I'd like to see is, while you're taking that therapy, is for the relationship to be in a place right now where you can spend time together, okay, and you can be showing in the meantime how you're building your relationship with Ellie. And then what I'd like to see over a period of 3 months is to see where you're at then, just to see where you're at right then, because you can't keep putting, okay, this little one through that. And quite frankly, with another one on the way, there is no way in hell, okay, that you're going to bring another life into this world with dysfunction. No way. You need to be able to sort that out, you know? You understand what I'm saying?
Yeah.
Yes.
Is that something that you feel that you can both make an agreement on?
Yeah.
Is that something you both feel comfortable with?
I've told her no matter what it takes, I will be there at the end of it. If she wants me, then fine.
Okay. But I have to say right now, it's not healthy. And somebody has to call time out on that, you know? And I think it would be the healthy, mature decision to call time out right now on this relationship until you can get yourself sorted.
Yes.
For everyone. For everyone. I really do. I really do. Is that something we agree on?
Yeah.
Definitely.
Yeah? You okay about that?
Yes.
You okay? I
thank
mean,
you.
of course not okay, but understand that it's a necessity.
Yeah, thank you.
And there's a little girl there that needs guidance, that needs the correct parental guidance.
I know.
And that's what I want to see her get. Do we feel happy with what we're going to do moving forward?
Yes.
Thank you very much for coming.
Thank you.
Thank you. Welcome back. My next guest, Dave, and his partner, Lisa, came to me because they say that ever since their 14-month-old son was born, they can't have the family life they've always dreamed of. Why? Because like many women in the UK, Lisa unfortunately suffered from postnatal depression, which has had a huge impact on her and her relationship. Take a look at this.
My name's Lisa and I've been with my partner Dave for nearly 7 years now, and we've got a son together and his name's Adam and he's 14 months old.
My partner Lisa, she has got postnatal depression and she's really struggling with Adam.
I get upset if Adam gets upset. Adam, come on. I can't sleep. I'm always thinking about him, worrying about him. It's exhausting. I feel like a failure. I feel like I'm a bad mum. If he starts crying, it's like someone screaming in my head. If I lose my temper, which I don't like, I might swear, but then I feel bad because I'm swearing at my son. Or if I have to correct him, I feel terrible that I'm about to correct him. If he's moaning or crying, I could end up crying as well. Come on.
We used to go out nearly every weekend, like couples do. And we used to stay at each other's side all the time. But like now, it's just completely different. Since Adam was born, we've slept in separate rooms. I think because we've got into this routine, we just feel like flatmates, to be honest. There's no relation there, really.
I try to talk to him about stuff, but intimacy-wise, it's not there. We tried to hug each other or, you know, give each other a kiss and ask how the day is.
She don't want me touching her, she don't want to be sleeping in the same room. She's all Adam at the minute. And you do feel pushed out. Well, I do feel pushed out.
Welcome, the pair of you. Welcome. What is it that you feel for when you watch the videotape? What did you see?
I just get upset, just with Adam crying and the way Dave feels.
Yeah. So when did you first know that you were feeling different, and how did you recognise that you had postnatal depression?
I think straight away I knew, but I didn't admit to it. I was always upset, always crying.
Yes.
I felt like I didn't bond with Adam.
Yeah. Did you feel bad for that? Did
Yeah,
you feel
I
like you
felt bad.
should?
Yeah.
Did you have this ideal in your head that it was going to be a certain way and then it wasn't?
Yeah, I felt that bad. I even turned around to my mum and said, "Can I give him back?" And it made me feel really bad as a mother to say that.
Yeah.
Because, you know, Dave was bonding perfectly with him. I had a bad labour, so the first month I had to bed rest, so I couldn't do anything. So Dave fed him, you know, day and night. And I think that's why I felt like I couldn't bond. And then I panicked.
So you felt like when you were holding Adam, you didn't feel anything. You didn't feel any kind of connection.
No.
Any kind of
mother
bonding.
instincts. No, like, oh, I know what he needs. I know what that cry is. I know what this cry is at. I mean, in the hospital, I tried to breastfeed.
Yes.
Because I really wanted to have that bond, but the baby couldn't latch on, and then I think I felt like I'd failed because I couldn't breastfeed.
Yes.
So in the end, I just decided to bottle feed him, which, you know, it was good because I knew that he was getting fed. But I think even then, I felt like I'd failed because I wanted to breastfeed and I couldn't.
Right. So you felt you'd let yourself down and you'd let your baby down.
Yeah.
So hard on yourself.
Yeah.
So hard on yourself. And the journey for you for that?
It's not nice seeing her go through it and that.
Yeah.
I was just glad that I booked the month off. I mean, looking after the baby and that, I enjoyed doing that, obviously, but it weren't nice knowing Lisa couldn't have nothing to do with him, you know, so...
Yeah.
It was hard watching it.
You just got on with it, didn't you?
Yeah.
So you went back to work?
Yeah. Because I work shifts, so I'm not there in the daytime, and then...
OK. And then who would have the baby? You'd have the baby?
But then I'd have the baby all day, and then Dave wouldn't be until like 1 o'clock in the morning because of his shift work.
And how was that for you then?
Well, I was terrified when Dave
panicking, don't you?
work. I was literally petrified to be
knowing that she's left with the baby on her own.
with the baby. Yeah.
So you felt scared of what?
She's
Anything
crying,
happens to
anything.
the baby, you know.
So you got extreme anxiety then?
Yeah.
You started to feel anxious about being around the baby?
Yeah, if
and...
he was to cry or... Because I've got no, like, experience, first-time mum.
So the confidence?
Yeah,
the confidence of
just
knowing what to do?
Yeah.
And how to respond to your baby's needs?
Yeah.
OK, I'd love to meet your mum.
Thanks.
Let's meet your mum. I know she's here today.
No.
She worries. She wants nothing but the best for Adam. She just wants the best for him. Things like having a shower, getting the breakfast, seeing to Adam. It's such a big chore because of the depression. She finds that very difficult. Lisa needs help. She's so frustrated. She doesn't like to feel like this. It's heartbreaking because I just want them as a family to be happy.
What, you going to start me off? There we are. Oh, word. So, tell me what we've done here. I mean, you know, watching from the sidelines of wanting, you know, your daughter to be in a better place, what do you feel that she could do to actually help herself become more confident with the little one? What do you see happening?
Well, she's made the decision to come on the show.
Yes.
And to ask for your help. because it is very difficult. I'm sorry. It's difficult watching your daughter go through this, because I know, being a mother myself, I've always been proud of my girls. And I just wanted to be as happy as what I was when I had my 2 daughters, because it's a wonderful thing, and Adam's so adorable. I never want to give him back. I just wanted to get as much help, if there is any help at all.
But what I've heard is that you have been left with him, and you have this enormous amount of anxiety now when you are with him, which is a symptom of postnatal depression. So what is it that you feel when you're actually in his company now and that you're left with him?
I think it's just the crying that gets to her now.
Yeah, it's just the crying.
It's not so much worrying, you know, if he's got stomach pains or whatnot. Like, it's not that kind of worry, it's the crying.
It is also if, like, when Dave comes home, because we have different rooms.
So what have you got, 3 rooms or?
2 rooms.
So where are you sleeping then?
Because we've got a double bed in the cot room. Like,
You're sleeping in the baby's room?
because he always gets...
Why is that?
Because he always wakes up, he's never slept through.
Right, OK, so he hasn't slept through?
I mean, I says I'd do that as well, because obviously if he's getting up and then I'm getting out of the same bed, I'm waking Lisa up, and then she can't get back to sleep then because she's worrying about him.
Yeah.
Like now she still worries if he's too cold or...
What is it that you're worried about?
If he's coughing and he's sick, or if he's cold, or...
What's the worst case scenario? What is it that you're fearful of?
If he dies or if he chokes or something.
So that's what you're fearful of? You have alarms? Have you got your...
Yeah, we've got a monitor.
You've got your monitor?
Yeah.
I mean...
You got your baby monitor?
Yeah.
So you look at him, do you?
Yeah.
You got one with a little TV screen?
Yeah.
But you still need your husband in the same room, though? That's not enough? Is that not enough? What about if he's in his own room and you have a baby monitor that you can turn the volume down, but you can see, OK, and then at least you can have your husband back in your own bedroom and you're back in your own room? I mean, wouldn't that be a step forward?
Yeah.
We was on about doing
Let's
it.
talk about the reality of the relationship then. Because if you're sleeping in separate rooms, and that's been going on for like 14 months now, like what relationship is there?
It isn't really, is it? That's like we said to each other the other day, we just feel like flatmates, to be honest. It'd be nice to get back to normal, wouldn't it?
Yeah.
What would it be nice to?
Just share the same bed, you know, not anything, you know, just to have someone in your own bed.
Well, I'll tell you, I don't think that'd be bad either, do you? I mean, just saying. I mean, truthfully, I mean, you've both got to be feeling like, well, where's the cuddles? Where's just the intimate time? Just together.
Really none of that, is there? And then when
Do you not miss that?
Yeah.
Do you not miss being laying in bed with your partner and
that's what I say.
cuddle up?
I'll get in on the night and then don't know what kind of day Lisa's had, obviously. I'll talk to her if I can on the phone, dinner breaks and that, but I can come in and she, like the other night, she was upset when I come in. She don't want to be touched, she just, you know, she sort of like...
Do you feel that way?
Wants to be left.
If I've had a bad day with Adam and Dave, I don't know, gives me a hug or something, I'm just like, you know, get off, don't want to know.
Why?
Because I'm either tired or I'm just not in the mood or...
For a cuddle?
Yeah.
But why? Do you feel that's going to go somewhere else?
Sometimes, yeah. Most of the time, yeah.
So what she's saying is that she feels that if it's a cuddle, it might lead to further cuddles and basically more cuddles and more of those cuddles that you're not ready for.
No.
You're not.
I just don't want to feel like this no more. I really didn't think this would happen to me. You know, I'm just tired of feeling down all the time and I hate getting up. You know, I'm supposed to be happy we've got a family. You know, he's nearly 14 months old and I'm not happy.
The reality is that you've got to look at how you're going to take these steps forward in order to get better.
That's the first time I've left him with someone he's never met before.
Good, that's a start.
Really sick of this, you know. Sorry. Sometimes I think it's someone else's life and I'm living it through their eyes. I never thought I'd be the person experiencing this. And it's horrible because You know, I should be enjoying life. I've had a son, we've wanted a child for ages. You know, when I was pregnant, I used to vision, oh, we go to the beach and be a family, and it's nothing like that. But when I look at myself in the mirror, I don't see me. I don't see the way I used to be.
I mean, I wouldn't say I'd just leave her or like, because I wouldn't, but it would be hard. Obviously, living like this is no good for Lisa or me, or the baby.
My fears for the relationship is that Dave will leave. I think it doesn't matter how many times he'll say, I'm not going to leave you, I'm not going to leave you. I still feel like he's going to leave, because why would you want to be with someone who's so depressed and low all the time?
I mean, my hopes for the future, obviously Lisa gets better. Perhaps Adam, we will have another little baby.
I want us to become more of a family. You know, me and Dave have that intimate side. Just the word happy.
My hopes for the future is that Lisa will get better and that they will be happy. She needs to build a confidence up, to enjoy the time with Adam while he's so tiny, and to get herself right.
So I'm watching the tape and I see this underlying fear of you feeling like it's, you know, the relationship's going to end up falling apart because there is no relationship between the pair of you.
But that's, I mean, before all this was going on, she's always had it in the back of her head. If we have a bad argument, I'm going to leave. But I don't know if that's...
there anyway?
Yeah, I don't know if
so
that's...
the anxiety's there anyway?
My parents split up, so...
So we're dealing with a lot of anxiety. I mean, we've gone from, you know, a very unideal labour, OK? You had postnatal depression, and now we're dealing with a symptom of that, this huge anxiety that you have constantly, you know, and I want to be able to look at how you move forward with little small baby steps you can do to make you feel more comfortable. I mean, of course, you're feeling like you don't want to be touched, you're hypersensitive. You know, you're scared that it's going to lead on to something that you're not ready for quite yet. Yet the reality is that you've got to look at how you're going to take these steps forward in order to get better. You know, because you've got to be able to really decrease the amount of anxiety that you feel with Adam, so that ultimately, the more time you have away, the more time that you guys can connect and get yourselves back on track as well. Look at him, love him.
That's the first time I've left him, you know, with someone he's never met before.
Good, that's a start. How does that make you feel?
Happy.
He's happy. Look at him. He's happy, love him. But it's okay.
Yeah.
It's okay because he's being cared for and looked after, and he, you know, and he's enjoying the little toys there on the table. Here's the first step today. You came here and look, you're not with him, he's being looked after, you can see he's enjoying himself, and that's what I'm saying I'd like to see you do when you go back home. So I'd like to make sure that I can bring you back and forth for a week, okay, at your house, because what I'd love to be able to see, okay, is for you, we'll supply the car, okay, so you can go back and forth, okay, to your daughter's house. And what I'd like to be able to see from yourself is for you to be able to wean away, okay, in the house first, all right? Okay. So, mum's with Adam in the house, and you're upstairs. I don't care if you're taking a bubble bath, reading a book. I don't care if you're washing your hair, grooming it, painting your toenails. I do not care. What I want to see is mum with your little one, and you just detaching yourself in the house, all right? Then what I'd like to see on the next day is I'd like to see you actually pop outside the house and take a walk around the block and come back again. You went, oh my God, your eyes just went, a walk around the block. Yeah, a walk around the block. But as long as you show him that you come back, then what you're teaching him is object permanence. In other words, you can see me, now you don't see me. You can see me, now you don't see me, because I come back. You need to teach him that so that he doesn't feel that anxiety. What we're learning for you to do is literally just to wean you so that that anxiety, when you're away from him, it doesn't increase.
Would I say Mummy's going out? Would I make an effort so he knows I'm leaving?
Yeah, and it's really no big deal. Like, you know, you don't have to be a big mummy's going out dance. You know, look at him. Just look at him. He's fine. He feels that. He knows that. He can sense that. You know, but you make him nervous as well. If you're nervous, nothing is going to happen to him. He's being looked after. You know, and you've done that today. So I'd like to see towards the end of the week, okay, from upstairs to 3 times around the block to an hour for you guys to go out on Saturday for lunch together. And we'll pay for your lunch, okay? I'll take you out for lunch. Mum, babysit so that you can go out and have that time just to make that first step in connecting, okay? So that you know that you can do it. And that when you come back, that you know Adam's fine. So, can we take the bed out of the baby's room?
Yeah.
Yeah, I want it done anyway.
Now, let's talk about this intimacy, because obviously you're worried that a cuddle's going to become a cuddle. OK, so where can we safely say that we can cuddle with knowing right now, respectfully, it can't go anywhere right now because it's just not in the place where you're at right now?
It's meant no difference to me anyway. I've been made love for ages, so it don't bother me, like. You know? I'd be happy to go in and give her a cuddle every night before bed.
You know, you'll know when you're, you know, ready to take it the next step, and that's a conversation that you can have. But for now, I think it's, you know, we can safely say we know to stop there. Be happy for a cuddle. Give him a cuddle then. He's happy for a cuddle. All right. So, do we have a plan? Because I have to tell you, you know, for as much as we, you know, recognise the importance and awareness of postnatal depression, it's as important for us to recognise the symptoms of as well, which is this high anxiety. But there is light at the end of the tunnel, and quite easily, with taking these baby steps and being consistent with that, you can have yourself in a much better place, you know, as a family, and for Adam as well. So do we have a game plan? We've got Mum, Car's picking you up, taking you back and forth, making sure that you get to your daughter's house safely. We've got you going upstairs whilst you're playing with the little one downstairs. We've got you going around the block. The neighbours are going to be wondering, what's she doing walking around the block? OK, 3 times that day. We've then got you going out for an hour, whatever, coming back again. Do we have a game plan?
Yeah.
All right, good, because that little one there needs it from his parents. Thank you.
Yeah.